Good afternoon, everyone. Just afternoon on a Thursday. Beautiful day outside here in Richmond. I think it's going to be around 60 degrees today. And we're really excited. We have a special guest with us today, Reid Moseley, who is a sports therapist. And I didn't plan this, but, Olympics are in full swing. So maybe that's appropriate that we're going to be talking about sports therapy today with Reid. So anyway, Reid, thanks for being here.
Happy to be here. Thanks for having me.
So let's start by just letting people know what your journey was like. How did you get to be a sports therapist? What brought you to this point?
So I went into college not really knowing what I wanted to do. So kind of starting with a blank slate. One thing I did while I was in school is I was a manager for our school's basketball team.
Okay.
So I was at the University of Virginia. So I've always been like a avid lifelong sports fan. So I had some sort of inclination that I maybe wanted to do something in sports. But as I worked for the team and was around it more, it kind of opened my eyes to what some of the different roles are that are involved with sports outside of being like a player or a coach. So one thing that I took an interest in was strength conditioning and like performance training and that side of things. So I started actually interning in the weight room with our strength coach. So I thought that that's what I wanted to do. But as I sort of, got more experience with that and, the strength coach I worked with is to this day still a mentor of mine. And, just at one point we were discussing my future and he said that if he could go back and do it all again, he would probably go to physical therapy school. He made the argument that it kind of gives you a different lens with which to view movement and the human body, and that even if you still wanted to be a strength coach or a performance coach, you could apply that skill set in that arena. So that's when I started kind of looking a little more closely into physical therapy as a profession, not just sports PT, but kind of overall. And I realized that it checked a lot of the boxes that I wanted in a job. You get to work with and help people. So I've meet so many different people and get to interact with all different types of people, and you learn a lot about them and their lives. And I just think that's really cool. I would say that I also like that you're not tied to a desk. You're up, you're active, you're moving around. I kind of always knew that I probably wouldn't be happy doing a desk job. So physical therapy seemed to check some of those boxes for me. Then I started getting some observation hours at different clinics, which is something you need for to apply to PT school. But it was kind of a nice way to get some firsthand observation and kind of just confirm my interest in it. So from that point, I went into PT school right out of undergrad. I went to VCU for school. And so I still kind of had an idea that I wanted to gear more towards sports PT. But when you're in school, you don't specialize or anything. You kind of learn about everything. So you get a little more exposure to what's out there. So I actually graduated and took a job at just a normal outpatient orthopedics clinic. So we would see everyone, all ages, injuries from head to toe, a few athletes here and there, but it wasn't very specialized. So that changed this past summer. I actually started a residency program at VCU that focuses on sports physical therapy. So that's currently where I'm at. So I work at the VCU Sports Medicine Clinic, which is on Broad Street near the Siegel Center. So it's a really cool setup they have in there. Our PT clinic is right next to the athletic training room. So we get to see a lot of VCU's athletes across different sports. We also tend to see a lot of active people that maybe aren't college athletes, but your weekend warriors, your recreational athletes, that sort of thing. So that's kind of been my journey, and that's where I'm at now.
Wonderful. So you a little bit earlier you implied that there was undergrad degree and then physical therapy.
Yes.
So talk about that educational requirement. So a young person thinking about doing this, what can they anticipate having to do educationally?
So I was a kinesiology major, which essentially is a fancy word for exercise science. Most schools, from what I know, have some sort of program that's similar to that. It may be called something different, but usually kind of a good like exercise science like track. That said, though, a lot of my classmates had varying, like a lot of my classmates in PT school, that is, had varying degrees. You had people with business backgrounds, teaching backgrounds. Um, so the big thing is just meeting all the prerequisites. So I know lots of people that also majored in like biology or chemistry and just took some of the other prerequisites as kind of elective classes, and that still allowed them to apply to PT school.
So is this, you pretty much need to have like a master's level education?
So you don't need a master's per se, but bachelor's degree. But you just have to make sure at least a bachelor's degree, and then you have to take all the prerequisite courses. And so most PT programs will list that on their website or somewhere in the application.
So that's certification then?
Say that again, I'm sorry?
Yeah, the PT part is that's more like a certification then?
So it's actually a doctoral degree now. It's a DPT.
Right.
So it used to be a master's degree, and then within the last, I don't know, a couple of decades, they've transitioned it to now you have to have a DPT.
Okay, that's what I was getting at. Okay, so this is you actually have a doctoral degree then, be able to do what you're doing. Okay, so
correct.
Fairly extensive amount of education. I think that's the point that we need to make to a high school student who's thinking about doing this. It's not just 4 years. There's a lot more there to get to the point where you're actually practicing.
Yes, correct. So for me, it was a total of 7 years.
Wow. Okay. Yeah. All right. So when we, part of what we need to think about when we look at the type of work we want to do is how it fits us personally. And you were talking about checking boxes, right? So for a young person looking at kind of what are the characteristics you think that they should have, or what are the things they need to consider? Do you need to be a people person, or is this going to work if you're an introvert? Or what do you think those characteristics might be?
So I think being a people person definitely is a good place to start. So I work at VCU now, and then in my other clinic, kind of between the two, I'll see anywhere from 8 to 14 patients a day at one point in time. So you're interacting with a lot of different people throughout the day, and most of them are usually there for at least 45 minutes or an hour. So typically a lot of that time is filled up with treatment and exercise and that sort of things, but usually a lot of small talk goes on too. And that's kind of a good way. That's been really helpful for me to build rapport with my patients. And I think that's probably more difficult to do if you're not a people person. Now, that said, I had classmates who I would say were more introverted and maybe weren't quite as like outgoing. And I don't think that means they can't be a successful or a good PT, but I do feel like being a little more outgoing has been a quality that has helped me personally.
Yeah, you enjoy the work more because you are a people person.
Yeah, definitely. I think in addition to that, being a problem solver is probably another good skill set to have. So a lot of times, you might go into seeing a patient and you have a certain game plan in mind, but if they come in and something happened or they're feeling worse or whatever the case may be, you just have to be able to adjust on the fly. Right. Or if you're trying to strengthen a certain muscle and you try exercise A and that doesn't seem to agree with them, well, you need to be ready to figure out what options B, C, and D are to try to find a way that you can still accomplish the same goal.
And you're actually putting a plan of therapy in place. It's not just going in and saying, okay, stretch this, pull that. You're actually creating a plan for this person based on what their issues are.
Exactly. So when they come in for that evaluation, you sort of, look at everything you think is relevant, and you start to take the pieces of your exam and put it together into a larger clinical picture that then drives your treatment decisions.
Right. So, I know it can't all be upside. Maybe it is. I don't know, but I'm just assuming there's got to be, maybe there's what would you say the downside is to what you do, if there is one?
So
if there isn't one, that's fine too. But
yeah, well, that would be nice. But I think with anything, there's going to be some cons. But so the interacting with people all day thing. So most days for me, that is a great thing. But just like anyone else, there are days where maybe I'm not in the best mood or I don't feel well, and at that point, Yeah, exactly. So your conversations can be a little more forced and maybe not quite as enjoyable as what they would be on a normal day. So sometimes that's a downside. Um,
Mhm.
I would say within kind of the medical community, sometimes there can be some issues with what PTs are allowed to do within their scope of practice.
Mhm.
So kind of in the medical world, the physicians, the doctors usually get kind of the last call on
Yeah.
things, and they sort of get top priority, and that's a little frustrating at times because especially now, like as the degree has been transitioned over to a doctoral, the education has expanded a little bit in terms of what PTs are able to evaluate and try to screen out for.
Mhm.
So to give you an example, in Virginia and a lot of other states, there's what's called direct access, where a patient can come in and see me directly without needing to go see a physician first. At VCU, though, the policy is they have to go, no matter what, have to go see the physician,
Okay, so
which
that's
at times
beautiful.
feels like a little like an extra hoop that people have to jump through that may not be necessary in all cases. So I would say that's probably the two main things. But overall, I think it's a great profession. Those things certainly, I don't see them as reasons not to be doing what I'm doing. So
Yeah. So when so physical therapy is sort of the umbrella, right? And then you can
correct.
take that in maybe different directions once you get to that educational level. That
Correct.
kind of way to describe it.
Yeah. So you can be in like an outpatient clinic. You can work in a hospital. You can work in
Sports clinic,
nursing.
whatever.
Yeah, sports clinic. There's some universities that actually have PTs like in their athletic training room. So yeah, there's a lot of different arenas in which you can work once you
Yeah.
obtain the degree.
Or you can take it to professional teams and that sort of thing as well.
Yeah, exactly.
Yeah. Great. So, what is the one piece of advice that you would give a young person thinking about doing what you do?
So I would say once you get into college, try to get involved with athletics somehow. I think for me that was very eye opening and very helpful to kind of steer my path a little bit. You also just get a better idea of what's out there, and you can kind of see how those roles all fit together to form sort of that sports medicine team, or even more broadly, kind of that just the team or the organization itself. And there's lots of different ways you can do that. So I interned with our strength and conditioning coach. A lot of places will you can volunteer in the athletic training room and kind of see things from their perspective. Before I was an intern, I started off as a student manager, so that wasn't medical per se, but I was still around the team and around those things. And when I was applying to PT school, I think that looked really good on my resume. And it gives you kind of a unique experience too. So that would be my recommendation.
Great advice. So I know we've talked about this prior to our conversation here, and you've been gracious enough to agree to perhaps spend a little time with a student that might want to do what you do, and we certainly appreciate that. So if you're out there and you're needing some more information, you want to get more advice about being a sports therapist, you can get to Reid through us at optimumedcenter.com. Our office number is 804-417-4807, or you can just contact us through our website, optimumedcenter.com. Reid, thanks so much for being here today. I really appreciate your time and the information. Good stuff. Have a great day.
Yeah, thank you so much. Thanks for having me. It was a great time. Bye-bye.